Welcome everyone to Public Health Musings. I am so happy to be able to have you on the show in this month. Thank you so much for being so faithful to the show and listening in or watching on YouTube. Today I have a treat for all of you, but before we get there, my name is Dr. Caroline Kingori. I'm the host of Public Health Musings. I'm a faculty member at Ohio University, and I focus on public health, which is what this show is all about. So I'm excited today to have Dr. Kiosha Bond as a guest. Dr. Bond is currently an assistant medical professor in the Department of Community Health and Social Medicine at the City University of New York School of Medicine. She's also a visiting faculty fellow in the Reed Scholars Program at Yale University School of Public Health and diversity scholar for the Adolescent Medicine Trials Network for HIV/AIDS Interventions. Such amazing work you're doing. She completed her postdoctoral fellowship in drug abuse research at NYU, Rory Myers College of Nursing. She has a doctorate in health education from Columbia University. She's also a certified health education specialist and has a Master of Public Health, as well as a BS in psychology. For her profession, she's a behavioral scientist and sexual health educator and has focused her work on the complex intersection of race, sexuality, social justice, and health equity among individuals of marginalized genders. She focuses on understanding how sociocultural and cultural factors influence the transmission of HIV and also uses digital technology to develop culturally appropriate interventions to address these factors. So we'll dig further into the work that she does, but for now, please join me in welcoming Dr. Bond to the show. Yay! So happy to have you here.
Thank you. Thank you for having me. This is really exciting.
So just to let the viewers know how I know you, we are both part of the HISDP fellowship, also from Columbia University. And just seeing and hearing and learning about your work, I was like, yes, I have to bring you on. I haven't brought someone on who is doing, technology and health. And this is an area that we are really focusing on in that fellowship. So I'm excited to really hear from you, your perspectives and how you're utilizing that in, low income as well as marginalized communities. So, what's your story, Dr. Bond? Why public health?
Why? Why not? Right?
Right.
I always say, honestly, my story really starts, I think, on my junior year, and I shouldn't say it starts there. It starts from me. I was born and raised in the Bronx, New York, which is among the boroughs of New York City, considered was considered several times like one of the most unhealthiest boroughs in New York, and probably in the United States communities. And I saw a lot growing up, grow up in the 1990s, and now I'm gonna date myself a little bit, but I grew up during a time where there were mass incarceration because of the changes in laws related to drug dealing and selling. And along with that, you also have, HIV and the change in the narrative of HIV, where like in the 80s, there was really focused on gay men. And then when the HIV in the 1990s, the shift had became among cisgender Black women. And, and then also with, again, at that time, along with the number of incarceration growing, along with that, it was the amount of drug use in those communities was also growing as we were dealing with the crack epidemic. And so you can see how neighborhoods change the effects of the environment and people's direct environment on their health and their health outcomes, whether it's directly related or it's something just by being living in the community or having family members. So anybody who was living in those areas was somehow affected by those things. And as much as I always say, as much as like, I used to, when I was younger, grow up and I would go to school and that was a safe place. And I would go home and that was a safe place in my house. But you got to walk through those streets to get to those places. And so you can't help but notice it. And so I think like my need to want to grow up and have a career where I felt that I was giving back to community came from that, because I know as much as we talk about those negative things, there were also beautiful things about the community. It was the people, really, people who looked out for each other, who noticed, that my mom was walking home from work late. And so they watched out for her to make sure that she got into the building okay. And people who just saw us growing up and just looked out for us and make sure that we were okay as little kids. And so I think the community aspect of these places, even though they were affected by so many harsh realities, still really motivated me to want to change, because they deserve to have the best quality care that they could possibly have.
Wow, that's such a compelling story. And it's good to know what brought you to this place that this spot or this part of your life that you're in right now. And I know that, I said in your bio that your work in public health looks to address that complex intersection of race, sexuality, and those social justice issues that you raised, and also health disparities among individuals of marginalized genders. So first things first, what are marginalized genders? What do we need to know about them?
Marginalized genders are genders in our community that are usually not prioritized, and so in the encompasses of that, we usually categorize individuals like cisgender women and anyone who identifies as transgender or non-binary as being marginalized, because most of our health research, most of the information that we receive is not really focused on their needs. A lot of the work that's out there related to even medication has been geared towards cisgender men, and therefore it ignored some of the biological factors that may influence how medicine and disease develops, looking at domestic violence and looking at just discrimination because of your gender, sexism, heterosexism, those type of things, or your sexuality. It's all encompasses, and all these stigmas really influence how your day-to-day life. We try to have protective factors, and even in our positions as professors and as educated cisgender women, we still deal with those stigmas without even, with protective factors around us. And so those are just how we kind of define marginalized genders, really.
Awesome. And I know, you said that gender is not, a biological construct, but it really does affect the biology. Would you want to elaborate a little bit about that?
Well, when it comes to gender, I would say more not gender, you're assigned sex at birth. There are biological factors that influence how like health and medicine really, and diseases really affect you. Like even in the instance of HIV and using PrEP in itself. So if you are an individual who was born with vaginal tissue, it will take you 21 days for PrEP to be active in your body compared to someone who was not and is having anal sex only. It will only take 7 days. And so those are things that we don't really talk about. And so, we're marketing or promoting people to use certain medications, but do they really understand what factors into those things? And I think that's important. I don't think that deters people from doing it. I think that gives them, empowers them really to really have that kind of knowledge. And that's what kind of led me into really looking at how to educate women, cisgender women, about PrEP, because I thought it's a valid strategy and method for HIV prevention. I just don't think that there was enough attention given to the needs of cisgender women when it came to talking about it and marketing it. And mainly, a lot of times the medical providers that they may be encountering are not fully aware of everything that factors in when it comes to a woman having to take a medication of this nature.
Right on. And for the listeners and the viewers who don't know what PrEP is, do you want to elaborate for them?
So yes, so PrEP is a medication, is a HIV medication that prevents HIV from transmitting to someone who is HIV negative. That's the simplest way to talk about it. It comes now in many forms. They now have like a long injectable version, but usually it was a daily pill that you could take. And at the time, we only have one type that is actually viable for cisgender women. So again, that's something to really consider, where there's different methods and it's been tested out on cisgender men and also on transgender women to be effective. The only one actually is useful for cisgender women.
Awesome. So thinking of complexities, we already have those challenges where gender is concerned, but we are looking at the overarching issues too. And there's complex intersection of race, sexuality, social justice, and health disparities. So could you elaborate for us? What is this complexity? What does it look like? What should we be looking out for? I mean, I know it's a lot, but right. If there's, a way that you can just give us in a nutshell, why is this complex?
I think it's complex, honestly, because, I always think about this term intersectionality. And when I think about this, in the fact that you are not one thing in this world. You don't have one identity, really, if you think about it, right? And so imagine, like, like I said, I'm a Black woman. And so those are two different identities right there. I identify with the Black community, and I also identify as a Black woman. And then, we think about where I live at. I live in the Bronx, which is considered a very, a community that deals with a lot of different health disparities. And I live in an urban area, and that has its own factors in it. And, so and I come from a family where, our generation is actually the first generation that is going to college. And so those factors make and influence my life and my lifestyle, really. And the things that I come up against, and just the simple fact that I always bring up this issue when we talk about student debt. And we have, on one hand, they say, like, African-American women have the highest rate of education and graduation rates in the country, but they also at the same time talk about the student loan debt. And that's really because many of us are coming from communities where we don't have parents who can afford to send us to school and pay for it. And therefore, that factors into the increased debt burden that we have for education. It's not that we're not capable of this. We are very capable of the work and to be in these institutions, but we don't have those financial monetary supplements available to us. And so I think, like, when we talk about the complexity, that's how complex it is. Like, you could be educated but not have money. You could be and you could have, health insurance, but not have access to healthcare because you live too far from places. Those things matter, and that's how complex our lives are in general. And so just navigating this healthcare system while you're also with your different identities are living, that's in itself plays another role. So we, we face distrust. We have to deal with distrust with the healthcare system, which we do have. And we have that rightly. And I say distrust because there's a reason behind the distrust. It's hard to say that everyone's going to be treated equally. They're not in our society. And so that's where the complex come in. We don't have one identity in this world. And we start to add on the different identities that have been traditionally marginalized within the society. It becomes a bigger burden on that individual and having to navigate this healthcare system.
Right.
Well,
yeah, that's good in a nutshell, because it begs the question when we look at, again, this marginalized, populations, communities, minority groups or historically minoritized groups. And, we often say they're the hard to reach communities, right?
Say they're easily missed, because they're there, but you just don't want to look at them.
Right.
Yeah.
Right. And I think it's that complex intersection that you described, because there are all these other factors that we don't consider. In the past, we've looked at health from a really unidimensional perspective until we started introducing health disparities, social determinants of health, and looking at multi factors that influence health, and that's where that intersectionality plays a role, right?
Yeah, it does. And even talking about, I teach this course, an Introduction to Population Health, and we go through these terms in our class and talking about health disparities, health equity, and health equality, and why we are striving for health equity. Because there we're understanding that everyone is not the same. There can't be a one size fit all for everyone in our society. And that's okay too. In the sense that everyone is going to be different and they're going to have different needs. And we do need to strive for equity because they deserve to have healthy lives and to be able to live healthy and happy lives, and that I think is the catchment. I think so many times, I think even now that I've been in public health for, I think 20 years now, I keep dating myself here. But even the term health disparities sometimes hits me in the wrong place, because I think people got so used to it that they don't think it needs to change.
Mm-hmm.
Yeah. Or that it can change. And I believe it could change if we actually do the work and stop ignoring the problems, but, I really think we really need to just focus on the health equity part of what we can do to build a better environment and world where people can get quality health care.
Right. And speaking of health equity and the need for change and, trying not a one size fits all strategy, you have become very interested and are working on health education interventions that are using online technology and social media. So I'm sure there's a school of thought out there that thinks that why would you even try that? And then there's a new school of thought that thinks, oh, this is really innovative. We can't always just bring everybody into a classroom or a workshop or a seminar. We have to find ways to educate and reach out to communities in ways that relate to them. So tell me more about that.
Yeah, well, I've always been interested in technology, but I think unfortunately, we really learned how valuable it is during COVID and when we had the lockdown, and that was the only way we could communicate. And one big aspect that usually gets ignored in health is health communication, but it's so valuable. And we saw how valuable it was really during the pandemic time. Because one, we had to relay information to people, and we had to do it in a fast way, in an easy way, in a way that was accessible to as many people as we possibly could. We couldn't rely on pamphlets or them going to a doctor, because it was just so many other things going on. And that's where I see the strength of technology. Now, I'm not going to say there's not any issues with it, because there are. But that's the strength of it, is that we can communicate with a large number of people at the same time. And we don't need to rely on the same things that we did before. So someone in New York can talk to an audience in rural North Carolina about sexual health needs, and they can, in a rural community that really wasn't receiving this education before, can receive it now because of technology. And that's, I think, the strength of it, and why I really love it, is the ability to reach a large amount of people and communicate in a different way, and also acknowledge the fact that we are communicating in a different way. Social media has grown. It's grown so much that that people in my age range which is Facebook, is now that's like Facebook, which was created for college students at the time, is now for middle-aged people. And so that's how much has changed. If I talk to my students about Facebook, they're like, who has Facebook? My mom has Facebook. I was like, I know, I do. So with those things, technology really supports our aspect of communicating and again, reaching people that we weren't able to reach before. And I think that's just part of our growth in society, really.
I like that take that you have with that. And I think people tend to be afraid of something that they probably are not familiar with, or they haven't mastered, or, I think those are maybe the two key things. And I think communication definitely is really critical. And we saw that we can utilize, and it's not the first time that we've used technology in health,
We use it all the time. I think it's just that the aspect of using technology for communication now, beyond the telephone, is really what people are just blown by. But telehealth is growing. It's so convenient for many people. Again, and even with school and education, we have some pitfalls, but we still are relying on technology to allow us to educate our students and stuff. And so, and just communicating like this, we're not in the same room, and usually you have to go down to the same place and be in the same space to do these type of meetings. And so I think that's the beauty of technology in itself. And I do think what's nice that's also advanced is the fact that we have smartphones, where before, I remember in the 80s, someone having a home computer in the house was a big deal. Now everyone has one in their hands, really. And so it's an affordable computer that gives you access, to internet. And there's, again, other factors that play a role in it. But we are advancing and having more community Wi-Fi and things of that nature, so people can have access to the internet. But it is a great tool, and it's just a tool that we just need to learn how to use well.
I agree. Totally. So you started talking about PrEP, right?
Yeah.
And this is also a really innovative way of reducing HIV risk. And you did explain what PrEP is and why it's important. Is there anything else you want to add with regards to that before we get to your work? Or you can even combine that, and talk to us about that e-health intervention to increase PrEP among Black women.
Okay, maybe I'll just talk and see what happens. I always do that. Well, I feel like PrEP. So to kind of tell you a little bit, I went to a conference in 2014 that was focused on HIV and women's health. And that was the first time I heard about PrEP myself. And I was like, what is this? And they were asking people who knew about it. And I saw what stuck out to me is that when they kept talking about it, I did not hear them talk about cisgender women. And I was just like, we're at a conference focused on cisgender women's health and HIV, and I'm not hearing their narrative. I'm not hearing the direction of how this is going to be applied to them. And I saw it in the community, and gratefully my advisor, my dissertation advisor, I was talking to her about it, Dr. Barbara Wallace, and she was like, well, if you want to look at it, you can do that. I was like, but people don't know what it is. And she was, and she's the one who was like, well, you tell them what it is, and then they'll tell you what they think about it. I was like, and my whole thought was, how am I going to do that? And she was like, well, you could create like a health video on it. It's like, with what money? I'm a really, because it was like, I can't hire actors. I don't know, like, how am I going to really do this? I'm not the CDC. I'm not the Department of Health. I have no resources. I am a poor doctoral student right now at this stage. And she was like, she introduced me to this software that other students she knew had used, and she was like, make a video based off of what and do that, and we'll see what women think about it. And particularly, we were focused on Black cisgender women, and that's what happened, and that's how this started. And it really was just to like as a way for me to educate the women, so I could kind of get their views on, is this something you would be interested in using? Would you tell other people about this? Other women, do you think this is useful? Even if you don't think it's useful for yourself, because sometimes, because there's a lot of stigma associated with sex in general, people may not feel comfortable saying that, yes, I'll use PrEP or whatever. And we got to acknowledge that a lot of people have a low perception of their risk levels, low perception of their vulnerabilities to HIV. So I was like, is this something you think this will be useful for other women? And honestly, I was, really shocked just like listening to it. But a lot of the women were interested of it. They never knew about the majority of them. I think about 95% never heard of it. And even in the comments, when we're asking about it, they just never thought it was something for them. And that's something I constantly hear. And it's 2022, and I still hear that same narrative with cisgender women, that they don't realize that it's something that's for them also. And I think mainly because, no one's talking to them about it. It's not part of the conversation, and so when it's not part of the conversation, it's not a concern. So I think, and so my goal really is to bring awareness to people. And I'm not saying that PrEP is the end all be all. I'm saying it's an option, and people need to know all their options to make healthy decisions for their lives.
I think the next part that I was interested in, from what you started doing after learning more about PrEP, and that it's not really being advocated or advertised among cisgender women. So you created this learning options through video education. What did you learn from that? Did it increase PrEP? What were your findings?
It didn't increase PrEP uptake. It just increased knowledge. And so that kind of led me to seeing that I think one of the main things that I learned from that is the stuff that we use to kind of help create the video, which are the factors that will help facilitate PrEP uptake. And we maybe, and that's probably leading to like my next our level study grant proposal, really to kind of see like, there are factors like communication with the provider and communicating with your peers, and also barriers, which is the adherence issue of having to maintain it. So now that we have the option of more long-acting PrEP, how would that factor in for women, and do women know about it? Again, because what I was seeing is that, women do see it as a good resource, but they're still hesitant to try it. And we just need to figure out why. Mm-hmm. Understand that better. I don't think this is something we should just put down. I think this is something that we can figure out, like, what will work. And because even in the conversations that in the interviews and focus groups that we had, women have a lot on their plates on a regular basis. And again, that comes into the whole gender issues with different roles where you can, and how we're looked at in society of having to do it all. And that plays a factor in our decision making when it comes to our sexual and reproductive health also. So I think those are things that we need to consider. And this, the video itself was well received and looked as a great resource for increasing education and awareness. But now here, what can we do now with the next step, which is how can we increase uptake? And what does that look like really for cisgender women? Because we are seeing also there's a disproportionate rate among Black and Latino women who have new HIV infections, but they have a lower rate of uptake of PrEP. And that means that there are more factors involved with it. So, and that's the next step for us to go to kind of address it. This is a motivation for more interventions really to address those needs. And instead of ignoring them and just saying, well, we have it, and I don't know why they're not taking it. It's like, well, let's figure it out. Let's do the work to do that. And I think, technology, again, I always say can't fix everything. I think it's a good support for certain things. And I think that's where we can meet at. I do believe that increasing knowledge, people does help them make better decisions about things and stuff.
Yeah. And I'm wondering if that has anything to do with some of those barriers. I know that internationally, there was a huge focus on women sex workers, and their uptake was a little different. So I'm wondering, maybe do these women consider themselves not at risk? Because they think, oh, we're not having 100 men, things like that.
Yeah. Yes. I mean, and that's a major factor. I do a lot of talks, community talks, and sometimes people are like, well, it's not me, and they say things like I'm married or I've been with my partner for such amount of years. And so I don't get around, as they say. It's like, I'm not getting around. And it doesn't matter your number of partners, really. It's about exposure. So your exposure doesn't, having multiple partners increases your likelihood of exposure, but at the same time, if your partner has other partners, that plays a factor in your vulnerability also. And a lot of women and in these conversations still don't want to have these conversations and reality checks. And when it comes to it. So, and they really are hesitant to understand that sexual health isn't something that is about what you're doing wrong or just being disease free. It's about wellness, and wellness comes from preventive strategies, and that includes regular STI screenings and regular HIV testing. And getting an HIV test and getting the regular STI screening is nothing. It's not reflection of you as a person, in the sense of that doesn't mean that, oh, if you do these things that something's wrong with you. No, it means that you're doing the right things because you're trying to make sure that if you are aware of your status. And so if you're aware of your status, you know exactly what you need to do to continue with your status and to be healthy. Mm-hmm. And if you, if you happen to be HIV positive, then you also learn how to engage in care so you can receive the treatment that you need so you can be healthy. That's the thing. We still live in, I think it's been 40 years since we discovered HIV, over 40 years, and we're still living with that same stigma that we've been living with 40 years ago. And it hasn't really changed that much. It's slowly changing. We're slowly having conversations, but we're having these conversations in pockets. And a lot of times, just to be honest, when I have conversations with Black cisgender women, a lot of time there's still a lot of stigma associated with HIV, associated with sex in general, and these ideas. I even did a paper looking at race-based stereotypes. And one of the things that came out of that, what was interesting, I'm looking at listening to these transcripts, and I'm listening to these focus groups. And these are young women, young Black women living in New York City. And I was hearing like old tropes, old stereotypes from the times of enslavement here in the United States, historic. And I was just like, wow, you see how the racism and the sexism, the gendered racism that we experience in this country has continued for several generations. And one thing, constantly we talk about Black people, the Black community is not a monolithic. There are so many there's those of us who were born in the US and descendants of enslaved Africans here. There are those of us who are from African countries and come over here. And there's those of us who are from the Caribbean islands. And you know what? One thing that occurred, and I always say this and acknowledge this in the work that I did, I was like, we are not a monolithic group of people, but we are experiencing this racism, all of us, and it has an influence on our lives. So it's important for us to kind of acknowledge that and how it's affected us. Because I'm just sitting here and that impact, and that's what I brought out in the paper. I was like, that's the reality of it. Like those things, being in this society really impacts how we view ourselves and our own sexuality. And again, it becomes a more complex issue, of like your value is placed on your sex, how you're having sex and your sexual identities. And so I think it's important for us to not ignore that when we have these conversations and not think that that's not, a factor when it comes to people making decisions about their health.
Right. And I believe that's what happens. It affects those misperceptions and then perceptions, and then even ability for this cisgender women to negotiate, protective measures, whether it's condoms or it's pre-exposure prophylaxis. And I see really similarities with the uptake of PrEP and how that was challenging when condoms were introduced.
Yes. I always bring that up. I was like, we have lessons that we learned from the days of condom use. And it's still having a factor with PrEP because I think like people thought, oh, PrEP is here, so we don't have to worry about condoms as much. And I was like, no, those issues haven't gone away. It's just now you got another form to that we have to deal with. It's still the same problems and barriers.
Mm-hmm. Yeah. And it's like, oh, well, we still have to think about other sexually transmitted infections. And, how do we market this to young people as opposed to partnered women? The ones who are saying, I have a partner, but they really don't know what's going on that other side, right?
Yeah, and I always try to just approach people like I focus on sexual wellness, and that encompasses so many things. Your sexual health is not just about being disease free. It's about your emotions and your mental health as well as your physical health, and so that's gonna there's so many different things that you could do for that. Whether it's reading a book to learn more about your sexuality, or it's, going to the doctor or to a provider to get your regular healthcare screening, or to use PrEP, whatever it may be, to help you focus on your own wellness for your life.
Indeed.
And I try to bring that support, because I'm just like, that's one aspect I feel like of our bodies and of our health wellness that gets ignored until it's a problem.
Mm-hmm.
It's like, you go to the doctor, you go to your primary care, and there's so many people who say they don't get asked about STI screenings and during their primary care visit, and I was like, they check your cholesterol, they check for, if you have diabetes, you check your heart and your blood pressure. But I was like, check my, check to see if I have a sexually transmitted disease or not. I mean, and it should be so normal. It should be so normalized. And, but we don't. Mm-hmm. We still a struggle. And even in and I work I am in a medical school institution, I always feel like that's one aspect that even the health profession schools don't give enough attention to. Because now at the same time, you have patients who may be uncomfortable with talking about sexual health issues, but it's bad if you have health providers who are uncomfortable talking about sexual health issues, who they're supposed to go to for this, And it shouldn't have to be the sex clinics in communities. This should be something that you can get with your primary care wherever you go. This should be just standard. It's supposed to be standard, but I feel like the sexual health clinics are for special needs or emergencies stuff, in the sense of that's the way they should be looked at.
Mm-hmm.
It's not separate. This is part of our whole bodies, and we should embrace that. And I think if we had real conversations, if we were focused on more comprehensive sex education, if we were focused more on people and individuals who can get pregnant, being able to make their decisions on their own regarding their body, I think we wouldn't have as much stigma. We wouldn't have as many issues as we have as it relates to sexual health. Sex isn't bad, but how we provide healthcare related to sex is bad.
Exactly. So I want to touch quickly as we start winding down on your work with Black transgender women. That's a relatively new area, and you have a intervention called Transgender Unique Resources and Networking through Internet Technology, which is Turn It Up intervention. So what are we turning up, Dr. Bond?
Here's the, it's always a story, I feel. And I think I get that from my parents are from the South, they're from North Carolina. And so I think I get that from my Southern roots of having that storytelling thing. So when I was doing recruitment for Love Study, one of the issues, and I was meeting different groups and different organizations. And when I would talk to different people, they were like, oh, this is great. And so I provide services to the population that you're trying to recruit for and stuff. And then they would be like, do you have anything for transgender women? And honestly, at that time, I was focused mostly on Black cisgender women. And so I hadn't done any work with transgender women. And so I was just like, no, but can you tell me what's going on? And they were talking about some of the health issues that they were having, and really about, the harsh reality of how they're discriminated within the healthcare system and in other aspects of our society also. And having to deal with that. And so, I was just meeting people and it kept coming up, and so I was just talking to some transgender women at a community organization, and we just had a really honest conversation about certain things. And I was like, you know what? I don't have anything now, but I said the next opportunity I'm gonna, work on something that to address some of these issues that you're talking about. And one of the things that came up was just like how, I don't like to develop interventions that are just focused on everything that's bad, everything that's gone wrong. I try to enhance what's good. And one of the positive aspects was, is there social networks and how they continue with their social networks, which is they, social media and social technology. A lot of young trans individuals, they rely on like some of the social media groups just to gain support and to learn more about their gender identity and to build community and stuff. And so the focus of Turn It Up really is to really see how transgender women use their social network, there's social media networks to gain support for related to their sexual health. And so it's a formative study where we're just doing interviews and focus groups, getting information about their use of technology, as well as their use of technology in the sense of not just use for technology just for sex, but also for like health information and dating and just socializing, just to see how people use it, and also what they would want to see if we were going to develop a e-health or m-health type of intervention geared towards transgender women, because one of the other downfalls when it comes to HIV prevention interventions for transgender women is that they usually get lumped in with men who have sex with men, and they're not men. That's not their experience in this world. And so we need more tailored interventions for transgender individuals. And so that's the focus of it, is to really get a good sense of what they're experiencing and what they want, like what will look good for them and what will be good for them, and that to support their sexual health.
Great. So you've done all this work that's really impactful, and it's making a difference in the community. From a policy level, right? What do you think are the implications of the work you're engaged in?
Wow, policy level. I do feel, I guess at a policy level, I would especially say that there is a need to have policy that protects people's sexual and reproductive rights, mainly because we are still living in a very patriarchal society that ignores individuals who are not cisgender male and their health needs. And there are so many factors that play a role in the health and well-being of individuals who do not fall under those categories. And so my work in itself really encompasses that, and how like important like comprehensive sex education and information is for people, and also how we need to, and even in information that we're providing for policies within healthcare settings, it's important for us to not treat everyone the same way, in the sense of, they're going to have different needs, and we need to modify those things, especially like we're talking about things like PrEP and talking about having a gender affirmative care for transgender individuals. So I think that's where my work really supports the need of it, and looking at that and factoring that there are structural factors that play a big role, and racism is still has a major impact on the healthcare of Black communities in general. So
wonderful. Now, you've done all this work. I would hope that you have some fun in your life, and that you've had some memorable moments, even in your work. Because I feel like our work really intersects even with our own lives, and we do it. I enjoy talking to the community members, having tea with them, just hearing their stories. And I think that's something you and I share, like storytelling is something that's really impactful. So when you look over all in your life, what is your most memorable moment in your
Wow.
work or your life to date?
Oh, that's a lot. That's my work, but like, I guess, okay, you know what? I'm gonna make it small. I was like, if I say my life, there'll be a lot of things in general. But the one time where I felt that, okay, my work actually matters, and it may not seem that important to many people, but it is to me, because I am a big fan of Shonda Rhimes shows, and I watched How to Get Away with Murder when it was on, and so it was my thing, and it was, you know, it was a thing that you knew that all the other people, especially all the other Black women that you knew were watching it also, like all my friends were watching it. So there was one episode. So this is like, I had did my dissertation that year. And so this is the fall season of it, of 2015. And there was a character, Connor. He was talking to his boyfriend, and he was telling him, it was just a very casual conversation they were having. He was saying, yes, he said, I start my prep regimen this week. And my phone blew up, like, you know, and my phone blew up, the social media account blew up with just like my friends and other people who knew about the work that I was doing, hearing prep being mentioned on this TV show that they all watch. And you know what? That to me made me feel like this is why my work matters, because they knew what it was about, and it came from the work that I was doing and the advocacy that I was doing and talking about it and making it something that was considered to be normal for people to do. And so that made me realize that that's the importance of like health communication and using technology to reach out to people. And I know it was just like so weird. It's always funny because my friends was like, do you know? They was like, you know about it? It's like, I didn't like, honestly, I think my friends at some point and some people in my social network thought I made prep. And I was like, I didn't make prep. I just, because they was like, do they know? They know you? I was like, they don't. It's not me. I didn't create this, you know, but it really touched me because it was just like, wow. One, they listened and they learned something from that experience and from the work that I was doing. And that's what it needs, you know, and they were able to pass that information on to other people and stuff. And when they saw it on TV, it resonated with them. And so I just felt good about that. I was like, that's how it should be. We don't need to hoard this information to ourselves and research and in academia. I was like, it's for the communities, for the people, it's for their knowledge and stuff. And so that was one thing I think that sticks with me and keeps me going. I was like, it's for the people, it's for the community.
Totally love that. Because I did watch that episode and I used to watch that show. And yeah, I was like, oh my God, did they just talk about prep on TV?
I know. I was all like, yeah. And then my phone blew up and I was like, oh, okay, wait a minute. I didn't make prep. Okay. But it was just hilarious. Just like, you know, but they knew about it. They knew what it was and it was in their heads, you know? So I thought that was good.
And I like that people associated that with you.
Yeah. And to them, I'm a trusted person, you know, and that matters. That matters in the community. To have a trusted person that you can ask these questions and who's not going to be judging you or you're going to feel judged from this. So I just, you know, thought it was that always sticks with me. And it's been like, almost 7 years now, but it sticks with me and it's my best story because I just thought it was funny, the kind of text messages I was getting. They was just like, do you know they said prep? Oh my goodness, they said prep. Did you hear that? Do they know you? You know Shonda Rhimes? I don't know Shonda Rhimes. Like I was just like, maybe one day I'll get to meet her, but I do not know her. But and I didn't make prep, y'all. I just was like, made an educational video to talk about prep and, you know, but it's stuck in your head and y'all know what it's about and that's what's important.
I think that's really, really amazing, you know, that you are the source of this information to them and they were able to connect, you know, with mainstream media.
Yeah. And they were able to see that also, in the storyline, this was a gay couple having this conversation, but that didn't deter them from like building the connection that this is a medication that anybody can use, So it's just that they understood the dynamics of it, and that was really important for me to really see that. This is why this kind of work matters. So.
Yeah, well, there's nothing that can trump that experience right now. I think this is a great place to end the show on, Do you know Shonda Rhimes?
I wish.
So awesome. I thank you so much for coming on the show. I really enjoyed talking to you. And I know we'll continue this discussion as we do the work that we do. Trying to make a difference in our communities and knowing just how this work means a lot to us. It's not just a job,
It's not, because we're part of the community. And I think a lot of people, when you are a part of the community that you're working with, and I don't say working for, but working with, I think it resonates differently for you,
Mm-hmm.
So it's not about the papers, it's not about the data, it's about the people, because that's how you see them, and that's the difference.
Yeah. And I feel that lasting effect and ability to just move them from one place to another in terms of their knowledge levels and also their health outcomes really does trump, the other stuff is because we have to get promotion and tenure.
Yeah.
But on our way to that, we connect with our communities. And I think that's just one of the best things about what we do.
It is. And and that's why I go to community groups and talks and stuff, because I was like, it's not about it really. I was like, I didn't get into this because of manuscripts and presentations. I got into this because of the community that I live in and the people in the community. So I owe that to them.
Indeed. Well, thank you again. And I will definitely look forward to the next time we have another conversation about the innovative work you're doing. And I just want to say thank you to the viewers and the listeners for being so faithful to the show. And I hope that you've learned something about incorporating health or incorporating technology into health and vice versa, and communication, the importance of communication. And so until next time, I hope to see you another time on another episode of Public Health Musings.